The top stories tonight in Y News. The Philippines reports 13,177 new COVID-19 cases today, the highest in the past 4 months.
The Metro Manila mayors are already coordinating with the Department of Information and Communications Technology on the possibility of having a unified vaccination certificate.
The Commission on Audit issued a clarification after its audit report on the Department of Health's COVID-19 Response Fund became controversial. Senator Manny Pacquiao has been charged with violation of PDP-Laban's constitution.
The Australian government has approved a new COVID test device which does not require a mouth and throat swab.
Excessive screen time harms children's mental health based on studies. Good evening, Philippines and the world. We are now reporting live from Quezon City. Today is Friday, August 13, 2021. I am Hardin Delgado.
Join us in the next hour as we deliver today's top stories around the country and in other parts of the world. I'm Angelo Castro III.
We are also seen in 1,935 satellite monitoring centers nationwide and via live streaming worldwide through the UNTV News and Rescue social media accounts and our website, untvweb.com. I am William Tino.
First in the news. The Philippines extends on travel restrictions for travelers coming from 10 countries, including India and Indonesia. Meanwhile, Laguna, Iloilo City, and Cagayan de Oro will be under Modified Enhanced Community Quarantine or MECQ from August 16 until 31, 2021. Rosa Licos reports.
Philippine entry of passengers from 10 countries, including India, United Arab Emirates, and Indonesia, are still prohibited. President Rodrigo Duterte approved the recommendation to extend the travel restrictions until August 31, 2021. This is part of the intensified border control to prevent the further spread of the more transmissible COVID-19 Delta variant. Filipinos under the repatriation program of the government and private sector are exempted from the travel restrictions. Meanwhile, from enhanced community quarantine, Laguna, Iloilo City, and Cagayan de Oro City will be under modified enhanced community quarantine from August 16 to 31, 2021. Apart from this, 10 other areas will be under the same quarantine status, including Bulacan, Cavite, Rizal, and Lucena City. General community quarantine with heightened restrictions will be imposed in Ilocos Sur, Cagayan, Quezon, Batangas, and other 13 places. Tarlac is under GCQ effective today, while on August 16, the same community quarantine status will be implemented in 24 other parts of the country until the end of the month. The Interagency Task Force has yet to decide on the community quarantine of Metro Manila, which is under ECQ until August 20, as well as Bataan Province, which is under the same strict restrictions until August 22. Rosa Licos, UNTV News and Rescue. We serve the people, we give glory to God.
The Metro Manila mayors are already coordinating with the Departments of Information and Communications Technology on the possibility of issuing a unified vaccination certificate. Marvin Canas reports.
The mayors of the 16 cities and one municipality in the National Capital Region have been sending lists of vaccinated individuals to the Department of Information and Communications Technology. This is in line with the national government's plan to produce and provide an official vaccination card for Filipinos traveling to other countries. The Bureau of Quarantine says that the information will be used in the issuance of Unified Vaccination Certificate, which will be introduced to other countries as an official proof of COVID-19 vaccination among Filipino travelers.
Once na magawa na po yun, unti-unti po ipapakilala po ng Pilipinas na nag-release na po tayo ng ganyang certificate po. So initially po magpa-partner po muna sila, pero eventually po once na accepted na po sila ng country of destination, yun na po ang official na gagamitin natin po as proof of vaccination po.
For the meantime, the Bureau of Quarantine or BOQ advises Filipinos going abroad to get their International Certificate on Vaccination and Prophylaxis, or otherwise known as the Yellow Card. It contains details about an individual's inoculation, including the brand of vaccine they have received.
Ito pong yellow card na to, kinikilala po ng lahat po ng signatory sa WHO since nag-start sila noong 1935 po. Ang yellow card po ay hindi po tinatawag, hindi po pwede maaaring gamitin as immunity passport. Ito po ay proof of vaccination lang. Kaya nabakunahan sila ng COVID. Ang hindi po mandatory ang pagkuha ng yellow card. Kaya ang kailangan pong gawin ng mga lalabas po ng bansa, makipag-ugnayan po doon sa country of destination or doon sa mga airline kung ano po ang requirement.
The BOQ added that as of now, the yellow card issued in the Philippines is recognized by 196 countries. Marvin Calas, UNTV News and Rescue. We serve the people, we give glory to God.
And in other news, the Philippine National Police accosted an average of almost 6,000 quarantine violators daily in Metro Manila over the past week. Most of them were caught not properly wearing face masks and face shields. Leia Ilagan has the story.
The Philippine National Police apprehended over 40,000 individuals for defiance of community quarantine restrictions and health and safety protocols in the first week of the re-imposition of the enhanced community quarantine. During an interview in the program Politiscoop, PNP Chief Police General Guillermo Eleazar said that ECQ violators were either warned or fined for various infractions.
Hindi naman natin kinukulong yan kasi most of the time, ang kasing implementation natin yan is based on the existing ordinances in the community. So may iba't ibang mga provisions yan. And usually, ang usapan dyan, merong iba caution lang sa una. Pangalawa, titikitan sila para magbayad ng fine, magmumulta.
The PNP has also tallied 2,398 non-authorized persons outside of residence or non-APOR violators in Metro Manila and 3,228 non-APOR violators in NCR Plus areas. Aside from NCR Plus, other provinces in Luzon, Visayas, and Mindanao also step up in the implementation of stricter community quarantine rules. General Eleazar reminds the public that the fight against COVID-19 is not only the government's responsibility but is everybody's obligation. Leia Ilagan, UNTV News and Rescue. We serve the people, we give glory to God.
Meanwhile, COVID-19 cases in the country continued to rise over the past few days. And today, the country logged more than 13,000 new COVID-19 cases. Aiko Miguel reports.
COVID-19 cases increased by 31% or more than 2,000 cases a day during the last 7 days compared to the period of July 30 to August 5. In the National Capital Region, cases also rose to 933 or 52% a day compared to the recorded case last week. An average of 52 individuals also died in the region due to the infection. According to the Department of Health, all areas in Metro Manila are now classified as either at high or critical risk for COVID-19, while 2 cities are now at critical level because their hospital beds are already full.
Total COVID-19 beds and ICU bed utilization of Pateros already at 100%. Navotas with 100% bed utilization. 17 out of 17 cities in NCR are with Delta variant cases as of the latest run, which was August 5.
Meanwhile, 54 areas in the country are now placed under Alert Level 4, with this having over 70% occupancy rate of their isolation, ward beds, ICU beds, and mechanical ventilators.
So pag tinignan ho natin yung mga datos, maaring ito po ay from the week prior to the ECQ pa ho. Ito pong ating nararamdaman. So we will see the effects of this lockdown or ECQ maybe 2 to 3 weeks after this 2-week period of ECQ. Ito pong pag-i-ease natin ng restrictions, ito pong pagtutuloy kung itutuloy ang ECQ o hindi, kung tayo po ay makakapagbukas na ng ibang sektor, kung bababa ang mga kaso at mga tao sa ospital, ay nagre-rely po iyan at depende yan sa atin lahat dito sa ating bansa.
Currently, the DOH has no recommendation yet whether to extend or relax the enhanced community quarantine restrictions in NCR after August 20. Aiko Miguel, UNTV News and Rescue.
To serve the people, we give glory to God.
The Department of Health has warned against medical professionals who are spreading false information about the government's vaccination program. Janice Inhente reports why.
The Department of Health or DOH reassured the public that all COVID-19 vaccines used in the country are safe and effective against COVID-19 and can lessen the possibility complications when infected with the deadly disease. The DOH reaction came after a video of a certain Dr. Romeo Quijano circulated who allegedly said that COVID-19 vaccines are unsafe. The DOH strongly condemned Dr. Quijano for providing false information about COVID-19 vaccines.
There is freedom of expression in this country. Tayo naman po ay hindi mag-e-engage sa mga ganitong tao. So para po sa mga ganitong grupo, lalong-lalo na po sila naman ay galing sa health sector din, sana po ay pag-isipan natin maigi ang sinasabi natin dahil nakakaapekto po ito sa pananaw ng ating mga kapwa.
The agency also warned media outlets that allow such resource person to spread false information that could harm the public.
We have warned the program already, no? Yung mga ganitong media na program, sana po nakikiusap kami na wag nyo na lang po sanang ma-engage ito po mga ganitong klaseng mga balita dahil hindi po nakakatulong sa kumpiyansa sa pagbabakuna sa ating bansa.
Meanwhile, several medical experts were also against Dr. Quijano's statement on COVID vaccines. Instead of helping the campaign against COVID-19, it made the country's problem even worse. For former advisor of the National Task Force Against COVID-19, Dr. Anthony Leachon, Dr. Quijano must be disciplined.
Irresponsible talaga. Alam nyo, sa panahon ngayong kulang, alam nyo, ang the best nito nang gawin, wag na magsalita. Ito si na Dr. Quijano, na Dr. Iggy. Tama na po. Ngayon, hirap na nga ang bansa na makatakas dito sa COVID na to at ang daming din nagpapabakuna. Hirap na nga tayo mag-explain. Tapos may maninira pa. Di ba dapat pag-isipan niya ng PMA o ng PRC?
Meanwhile, the UP College of Medicine clarified that Quijano is a retired professor at the university since 2014. In a statement issued by the UP College of Medicine, it says COVID-19 vaccines are safe and an effective way to fight COVID-19. Janice Inhente, UNTV, News and Rescue. We serve the people, we give glory to God.
The Philippine Health Insurance Corporation or PhilHealth admits it has yet to settle billions in pesos of hospital claims. JP Nunez will give us the details live. JP, why was the release of hospital claims hampered?
Yes, Diego, good evening. According to Dr. Shirley Domingo, the Vice President for Corporate Affairs of PhilHealth, several of their office workers contracted COVID-19. That resulted to the slow processing of hospital claims. However, PhilHealth officials down from the regional level are now working to augment its staff in some COVID-19 hit offices to speed the process. The PhilHealth official admits it has yet to pay billions in pesos of hospital claims.
There are billions of that are payables, but we have to reconcile our data with them, which we are doing naman. Nakikita naman kami sa kanila at the national and regional level kung magkano na ang payables ng PhilHealth sa mga individual hospitals po.
Domingo said that a huge portion of unpaid COVID-19 claims are related to COVID-19 testing. However, PhilHealth has already paid 12 billion peso worth of benefit claims.
Yun po, nag-encode pa tayo yun, kaya medyo late po tayo. But we have paid already at a total of almost 12 billion peso claims.
COVID-19 claims include testing packages, community isolation unit benefits, and inpatient benefits. The state insurer assures hospitals that they are on process to ramp up the release of COVID-19 claims among the remaining 25 billion pesos.
Tinututukan po natin yan. Alam po natin yan, nangangailangan talaga yung mga hospital ngayon ng karagdagang na financial resources, lalo na ngayon na itong variant na surge ay nandito talagang it's causing issues na with us.
Meanwhile, Diego, PhilHealth is also extending its debit credit mechanism with which PhilHealth pays 60% of hospital claims while the remaining 40% will be paid following full compliance to processing requirements. That is our latest live. Back to you, Diego.
Thank you for that report, JP Nunez. For those watching our 24/7 live streaming on YouTube, please click the subscribe button you see on your screen and ring the bell for notification. You may also follow us on Facebook.
Experts explain that there is no guarantee yet that even a fully vaccinated individual would no longer contract COVID-19, but vaccines help get protection from severe or critical conditions. In the Philippines, the Food and Drug Administration, or FDA, reports that Filipino vaccinees who got infected with COVID-19 is not yet at 1%. Aiko Miguel reports.
11.7 million Filipinos have so far received their first dose of COVID-19 vaccine, although 735 of the Filipinos who have been partially vaccinated have had breakthrough infection and 65 have died. These numbers can be considered small compared with the number of Filipinos who have been inoculated.
Out of 11 million ito na nabakunahan natin for the past 6 months, no? 10% ito ng populasyon ng Pilipinas. So kung bibilangin natin ang percentage nito, this is less than 1/1000 of a percent. No? This is 0.0013% out of 9.1 million fully vaccinated individuals. Napakaliit na porsyento, especially considering na ngayon for every 100,000 Filipinos, merong 6 or 7 na nagkaka-COVID araw-araw na nagde-detect natin.
According to the Food and Drug Administration, breakthrough infection is detected within more than 14 days after a person receives his second vaccine dose. The FDA clarifies that vaccines do not give COVID-19 infection to people.
Hindi po yung bakuna ang nagkukos ng COVID, para lang iklaro, no? Because the vaccine that we use are inactivated viral vaccines, viral vector, or mRNA vaccines. Hindi sila nakakakos ng COVID. Pero ang sinasabi nga natin, habang hindi ka pa fully protected, talagang maaari ka pang magka-COVID.
Meanwhile, the Department of Health and the FDA appeal to Filipinos not to go vaccine hopping, especially those who are already fully vaccinated. A person should not receive more than 2 doses because the Philippines is not yet implementing booster shot vaccination.
Tandaan po natin, kapag nagpabakuna tayo, tapos kumuha pa tayo ng bakuna na isang set pa, may kababayan tayo na nade-deprive of the vaccine. Sa health walang masyadong wala tayong nakikita na masyadong problema, especially kung magkakalayo naman yung vaccines, no? Kaya lang, yun nga lang po, talagang ang mali naman doon, meron po kasing tao na hindi makakatanggap ng bakuna dahil tayo nag-swapang at nagpabakuna tayo ng higit sa dapat nating tanggapin.
But sana, naiisip natin, it's more of moral and ethical. Kung ano man po ang ibinakuna sa inyo, meron pong mga taong hindi nabakunahan dahil sa inyo. So lagi nyo pong iisipin yun na ang pakikipagkapwa-tao, lalong-lalo na ngayon, dito sa panahon ng pandemya, ay napaka-importante po. Kahit po na kayo po ay lumabag sa mga pamantayan at patakaran ng gobyerno, kami po ay may obligasyon pa rin na i-monitor kayo.
Again, a reminder from the government, listen only to experts in order to avoid confusion and contracting the deadly viral disease. Aiko Miguel, UNTV News and Rescue. We serve the people, we give glory to God.
Meanwhile, an additional 15,000 doses of Sputnik V vaccines arrived at the Ninoy Aquino International Airport this afternoon. The Russian vaccines are component to or intended for the second doses to those who have received its initial jab. Based on the emergency use authorization by the Food and Drug Administration, Sputnik V vaccine should be taken in 2 doses with 42 days interval. Russian Direct Investment Fund recently revealed that the 2 doses of Sputnik V vaccines may even have up to 180 days of interval. FDI Director General Eric Domingo, however, explains that the efficacy of the first dose will still take effect despite delays on the second dose.
The Philippines today logged 13,177 new cases of COVID-19, pushing nationwide tally to 1,713,302. The Department of Health, or DOH, said that the latest tally brought the country's active infections to a total of 96,395. Of these cases, 95.8% are mild, 1% are asymptomatic, 0.97% are moderate, 1.4% are severe, and 0.8% are in critical condition. Meanwhile, total recoveries rose to 1,507,069 after 4,322 more patients recovered from the disease. COVID-related deaths also climbed to 29,838 with 299 new fatalities. 4 accredited testing laboratories failed to submit their data on time, the DOH noted. Amid rising coronavirus infections, the DOH reminded the public to continue adhering to public health protocols and to immediately isolate and contact their barangay health emergency response teams should they experience any COVID-19 symptoms.
Senator Manny Pacquiao has been charged with the violation of PDP-Laban's constitution by one of the officers of the party's COSI-led faction. Meanwhile, a political analyst believes Manila Mayor Isko Moreno will possibly seek presidential or vice presidential posts in the 2022 national elections. Nel Maribohok will tell us why.
Disloyalty and violations of the party constitution. These were the complaints against Senator Manny Pacquiao and others which the PDP-Laban COSI faction received. The complaints were lodged by Raymar Masilungan, PDP-Laban's chairman of the Livelihood Committee. This is in relation with Senator Pacquiao's alleged plan to convert his own party, the People's Champ Movement or PCM, to a national political party. According to PDP-Laban Secretary General Melvin Matibag, Pacquiao has clearly violated the party rules which could lead to his expulsion.
On December 20, 2020, 18 days after mo mag-assume as president ng PDP, you presided a meeting ng PCM. And in that meeting, ang agenda one of the items sa agenda ng meeting is to convert PCM into a national political party, which is a direct violation of the constitution of PDP. So nandun na kagad yung disloyalty. May bad faith na kagad by practice. Bakit mo ginawa yun?
Matibag assures the issue will undergo due process. They will send a notice to Pacquiao for the senator to answer the charges against him. Pacquiao's camp has yet to comment on the issue. Meanwhile, Manila Mayor Isko Moreno is most likely to seek a higher position in the coming national elections. According to political analyst Professor Dennis Coronacion, the Moreno's transfer to Action Democratico is a clear indication that he indeed has higher political plans. Moreno was elected president of Action Democratico after he resigned as vice chairman for political affairs and member of the NUP. His former party NUP is seeking alliance with Hugpong ng Pagbabago, the political party led by Davao City Mayor Sara Duterte Carpio, who is open to run for presidency.
Probably the reason na magkakaroon nga ng conflict of interest kasi he might be pursuing his dream of becoming either vice president or president. So, pag sakaling gagawin niya yun, yung affiliation niya dati, yung NUP, related yan, sabi mo nga, related yan sa administration.
Nel Maribuhok, UNTV News and Rescue. We serve the people, we give glory to God.
President Rodrigo Duterte has accepted the resignation of Budget Secretary Wendell Avisado. Presidential spokesperson Harry Roque said that the president appointed Undersecretary Rosemary Canda as officer in charge. Avisado is on medical leave as the doctor advised him to undertake a series of examinations following his bout with COVID-19. For those watching us on YouTube, please click the subscribe button you see on your screen and ring the bell for notification. You may also follow us on Facebook.
The Commission on Audit flags a 2.1 billion peso undelivered motorcycle and vehicle license plates by the Land Transportation Office or LTO since 2014. But the LTO says plate production backlog is primarily due to budget constraints. Asher Kadapan Jr. tells us why.
The Land Transportation Office clarifies that just like any other national government agency, the LTO remits all its revenues collected to the National Treasury. Hence, it needs to request budget allocation from the national government for all its programs and activities. But the LTO explains that the agency has been receiving yearly budget allocation, which is just a fraction of what they have been requesting. Based on the 2020 annual report of the Commission on Audit from 2014 to 2020, the LTO has failed to deliver over 8 million plates for new motorcycles, while there are over 2.6 million undelivered replacement plates for motor vehicles. But LTO Chief Assistant Secretary Edgar Galvante explains that since 2018, they have been continuously producing and issuing plates for new motorcycles, and COA's data may be higher than the actual number.
I think nung ginawa yon, medyo audit ng much earlier dates yun eh. Kaya meron ng pagbabago doon. Kaya siguro yung 8 million na yun, na-reduce na. Para explain din namin kung ano na yung na-comply namin out of that. But again, we honor the report of COA and we will attend to the issues that are being pointed out in that.
According to Motorcycle Philippine Federation, the LTO should not be blamed mainly in the delay of plate production. MPF Director for Administration Atoy Santa Cruz explains that the production may have been hampered due to budget constraints and the implementation of the new law on motorcycle plates, which includes the change in size of the plate as well as its color coding system.
Dahil nakikita ko naman na sila gusto nila makapag-deliver. So dapat maintindihin din ng COA na sa amin, gusto talaga namin may plate number kami para hindi kami napagbibintangan dyan sa mga krimen na nangyayari ngayon. Dapat kausapin nila ano ba talaga yung root cause eh. Ano yung talaga problema?
The LTO is set to meet with COA on Monday to clarify the issue on the undelivered license plates. Asher Kadapan Jr., UNTV News and Rescue. We serve the people, we give glory to God.
The Commission on Audit issued a clarification after its audit report on the Department of Health COVID-19 Response Fund became controversial. COA explained that report does not mention any fundings by the auditors of funds lost to corruption. The agency explained that it was just merely pointing out deficiencies that can still be rectified.
The Land Transportation, Franchising and Regulatory Board, or LTFRB, says it is still awaiting the funds for the resumption of the service contracting program this year. This as the Commission on Audit flagged its delayed implementation of the program last year, which resulted in delayed payments to drivers amid the pandemic. This report will tell us why. The Land Transportation, Franchising and Regulatory Board, or LTFRB, has vowed to pay its pending payouts under the Service Contracting Program. The Commission on Audit on its 2020 annual audit report flagged LTFRB for utilizing only 59.7 million pesos or 1% of the 5.58 billion peso fund of the program. The state auditor noted that this was caused by the delayed implementation of the program, which resulted in delayed intended benefits to the public utility vehicle drivers and operators. The service contracting program was launched under the Bayanihan to Recover as One Act, also known as Bayanihan 2, to help PUV drivers amid the pandemic by paying them subsidies through kilometer rates and incentives. According to LTFRB Chairman Martin Delgra, they were able to use 1.25 billion pesos or 26% of the fund as the Bayanihan to Recover as One Act was extended until June 30 of this year. The program since then stopped along with the Libreng Sakay or Free Ride program.
Alam din po natin na kahit na sinagat po natin yung programa hanggang June 30, yung pagmamonitor, pagkukolekta ng mga data, pag-prepare po ng mga payroll at saka yung mga tinatawag na financial documents, hindi po natin maaabot dun sa last day.
Belgra says they are now processing the cash allotments for the 3.4 billion pesos from the Department of Budget and Management for the payment of pending payouts. He adds they are awaiting the 3 billion peso fund for the resumption of the service contracting program, which will be sourced from the 2021 national budget. Transport Group Pasang Mazda confirms they have members who have yet to receive their payments since last year due to problems encountered with the LTFRB's mobile application. The group's president, Obet Martin, says the LTFRB has promised that they will get paid.
Yun ay isa pang nire-resolve namin until now sapagkat maraming biyahe ang hindi properly recorded sa apps ng LTFRB. But we were assured by Chairman Delta, well, of course, the Secretary of the OTR, Art Tugado, babayaran naman yan. Kung matutuloy tayo by next month, everything must be patch up para diretso ng ating operation. Hindi kagaya nitong may naiwan, pero sinisingil, may inaasahan pa ba kami? Yan ang mga tanong bahali. Kailan ba kami babayaran?
According to Martin, the service contracting may resume on September 15. But now that more areas have been placed under stricter community quarantine, the group leader hopes that the program will resume at the soonest possible time to help not only the PUV drivers and operators, but the commuting frontliners in this critical time. Jorlene Delgado, UNTV News and Rescue. We serve the people, we give glory to God.
And for the news abroad, the Australian government has approved a new COVID test device that does not require a mouth and throat swab. Annie Mancilia will give us the details live. Annie?
Kat, after 6 months, the Australian government already gave a go signal to use the COVID-19 antigen saliva pen. This is the first rapid test that can detect antigens with only a small cup of saliva as a sample will do. It works by placing the pen in the mouth on top of the tongue and holding it with a closed mouth for 2 minutes. Although it looks far more comfortable than the mouth and throat swab, it still requires a health practitioner to perform the test. Path Diagnostics' Andrew Lloyd says the pen has 90% sensitivity and results can only take 15 to 30 minutes. Accordingly, the new COVID test could also be a more cost-effective way for companies to test their employers quickly, as the price is only about $9. The Australian government announced this week that it's expanding the use of rapid antigen tests as the country battles its third wave of infection. Kat?
Thank you, Annie Mancilia, reporting live. Many studies have found that excessive screen time harms kids' mental health. Aside from this, it can also hamper their physical activities. It may contribute to obesity, attention problems, sleep disorders, and problems at school. Joselito Liquido tells us the details live. Joselito?
Kath, a global study with over 577,000 participants aged 11 to 15 years old found that children are more vulnerable to developing mental health issues due to excessive screen exposure. Evidence became apparent after 4 hours of screen use for boys and 2 hours for girls. The difference in duration are in correlation to boys having a more active use of video games and computers, whereas for girls, it is more of a passive screen time, scrolling through social media and watching television. This is why the study lead author Asad Khan from the University of the Queensland School of Health and Rehabilitation Sciences believes that there is a need to recalibrate the kids' behavior towards healthier lifestyle. This means that whenever we can, we should replace the screen time with some outdoor activity. Dr. Khan says balancing screen with physical activity is the best solution to deal with this problem. Kath?
Yes, Joselito, how can children avoid dangers of excessive electronic screen use according to the experts?
Kath, experts say that to help avoid these issues, parents are urged to encourage children to engage outdoor activities. They can also ask their kids to turn off all gadgets during mealtime, family time, and hours before bedtime. Make it an effort to spend screen time together to make sure that what your kid sees is appropriate. Set a schedule. Tell them that screen time is only allowed after chores and homework are done. It is also recommended that children are to spend at least 1 hour in physical activities and are limited to 2 hours of screen use. Kath?
Thank you, Joselito Liquido, for that live report. And those are the reasons behind the news in other parts of the globe. I am Kat Dumaraos, live from Bangkok, Thailand. Good evening.
And before we close, we will leave you with the final word, giving glory to God. From the book of 2 Chronicles, chapter 7, verse 14. It says, "If my people, which are called by my name, shall humble themselves and pray and seek my face and turn from their wicked ways, then will I hear from heaven and will forgive their sin and will heal their land." And those are the reasons behind the news, August 13, 2021. I am Harleen Delgado.
Reasons we deliver to you as they unfold. I'm Angelo Castro III.
And because we need to know, we will always ask why. I am William Theo. We serve the people. We give glory to God.